Welcome to Restricted Practice Authorisation Panel Member Webinar Series. The webinar series has been developed for National Disability Services and funded by New South Wales Department of Family and Community Services, Ageing, Disability and Home Care, also known as ADAC. The webinars are based on training rolled out in New South Wales by National Disability Services, also funded by ADAC. Disability Services Australia delivered the training and have also assisted National Disability Services in the development of the webinar series. The webinar series focuses on the operational requirements of the Restricted Practice Authorisation mechanism to ensure consistent understanding, implementation, monitoring and accountability for practice and outcomes. Restricted Practice Authorisation is also known as RPA. The webinar series is targeted at behaviour support practitioners, clinicians from other disciplines such as speech pathology, occupational therapy and senior staff within organisations with relevant experience and or qualifications who can participate in or oversee an RPA panel. This is the fourth and final webinar in the series and focuses on the highlighted dot point RPA panel decisions, reviews and outcomes. The remaining dot points will be discussed in additional webinars. A workbook can be downloaded from the NDS website to provide further information. This webinar focuses on RPA panel decisions, reviews and outcomes. Content includes RPA decisions and reviews, outcomes of RPA panel process, consent, appeals and records management. The authorisation of a restricted practice should take into consideration the impact the practice may have on other people in the environment and needs to be clearly outlined as part of an RPA submission. RPA submissions lodged without the accompanying documentation should trigger a response from the panel that is educative and supportive in the first instance. Multiple submissions without adequate documentation require escalating response measures from the RPA panel which aim to address any obstacles to good work practice. For interim RPA to be granted, endorsement is required by the panel convener or appropriate delegate. Interim RPA will usually be conditional on the completion of specific tasks or the implementation of specific recommendations during the RPA validity period. These tasks or recommendations must be clearly identified. There is a provision within the RPA process for interim RPA submissions to be presented directly to the panel convener rather than to the full RPA panel. Where an RPA submission is clearly identified as review, the RPA submission documentation should include the previous outcome summary to inform the RPA panel's deliberations. The RPA panel should have access to the original authorisation documents to provide better context. Where discussions surrounding an RPA submission are proving particularly complex, the panel convener may consider seeking advice from external sources. When deciding upon an outcome, the RPA panel will formally authorise the use of the practice up to a maximum period of 12 months, withhold, refuse authorisation or grant interim and conditional authorisation up to a maximum period of 3 months. Furthermore, the panel will set a review date for each authorised restricted practice, completed required forms, seek written consent and record and track the implementation of any recommendations for practice improvement put forward. Generally, the purpose of an RPA panel is to provide authorisation for restricted practices, but on occasion the panel has the capacity to provide consent for Category 4, restricted access, and Category 5, response cost. Capacity is only appropriate in specific circumstances, which you will find outlined in your workbook. The RPA applicant may query the decision of the RPA panel within the available time constraints in order to clarify the rationale for a decision or outcome. It is important for service providers to maintain an accurate database covering the operation of the RPA panel. A summary data form for each RPA submission should be recorded following an RPA panel hearing. Completed forms should be maintained by the service provider responsible for the coordination and reporting for RPA panels. Thank you for listening to the webinar. If you would like further information, National Disability Services has a dedicated resource page available on their website, which provides links to the following: other webinars from the series, there are 4 in total, the PowerPoint presentations used in the webinar series, a handbook providing detailed information about the content in the webinar series, relevant ADAC policies and procedures relating to behaviour support and the RPA mechanism. ADAC District Behaviour Support staff are available to provide support in your local area. Thank you.